Okay, let's continue on to look at the last part of the chapter, that is health issues related to the human respiratory system. So we will be discussing about these obstructive pulmonary diseases, okay, or COPD. Chronic means long-term, obstructive means obstruct, halang ataupun block. Pulmonary refers to the lungs. Okay, and the diseases we'll be looking at these three: asthma, chronic bronchitis, and also emphysema. So in emphysema, the alveolus loses its elasticity. So that means it is no longer elastic and it increases in size. Okay, is this good? Increase in size? No. Okay, because if it increases in size, the total surface area of the alveolus is decreased. Okay, and the alveolus walls is damaged, and therefore the whole the whole episodes over here is that the gaseous exchange will become not so efficient. Okay, so let's look at this figure, COPD diseases. So the first one over here, this is normal bronchial. Okay, you still remember bronchial structure? So this is the normal air passage. But the bronchial of an asthma patient, okay, you see the walls have become swollen, okay, and also thick. So this results in the air passage become narrow. Okay, again, we say that the air, when they flow in, it is being obstructed. Okay, next one, moving on. This is the normal bronchial, and this is the bronchial of a chronic bronchitis patient. Chronic bronchitis. So again, this bronchus, okay, when you see over here, IS, it means inflammation, has got infection. So the inflamed bronchus in the patient will generate excessive mucus, too much mucus. Okay, so when there is infection or inflammation, there will be pus, PUS, provided, NANA, okay, produced. Is it? Sorry, not provided, produced. So again, it is blocking the air passage, and that is not good. Again, it's an obstructive disease. Okay, so the third one, we'll be looking at emphysema. So this is normal alveolus. Okay, but in emphysema, the alveolus has the walls has become damaged. Okay, and it is no longer elastic, and that the surface area, the total surface area also decrease, and it leads to less efficient gaseous exchange. Okay, so yeah, that's it about the introduction on COPD diseases. Okay, so the last two videos over here you can watch to further enhance your understanding and memory on cellular respiration, which you have learned back in chapter 7. So we have come to the end of the chapter. So let's look back. Let's recall. First, we describe the types of respiratory systems. Okay, in insects, okay, we have the tracheal system. Right, in fish, we have the gills. Amphibian, the lungs and the moist skin. And in humans, these are the structures involved. We have the alveolus. Okay, and then we also discuss about mechanisms of breathing. Okay, breathing is the process of inhalation and exhalation, and we describe that in detail. Okay, next is on gaseous exchange and also transportation. So it is subject to the partial pressure difference. Okay, the partial pressure of what? The partial pressure of the carbon dioxide gas and also the partial pressure of oxygen gas. Okay, also we talk about the mode of transport. For oxygen, it is transported in the form of oxyhemoglobin. In carbon dioxide, it is transported in three ways. okay, namely in the form of bicarbonate ion, which is about 70%, carbaminohemoglobin 23%, and carbonic acid, just a small percentage of it, about 7%. And the last part of the chapter is on the health issues. That means specifically COPD diseases. Okay, COPD or chronic obstructive pulmonary disease, and that are asthma, chronic bronchitis, and emphysema.